Hello, everyone, and welcome back to the Wayne Wellness Lunch and Learns. My name is Madeline Diaz. I am one of the wellness coaches for the MSC of Wayne Township, and today we will be talking about food allergy versus food intolerances. So let's go ahead and get started. Maybe. There we go. Okay, so before we get started talking about allergies versus intolerances, we need to have an understanding of what an allergy is and what really plays into that. So the best thing to start off with is learning about the basics of the immune system. So the immune system is your body's self-defense against foreign particles or objects. It has what is called immunoglobulins. These are also known as antibodies. These are to help recognize, bind to, and destroy any kinds of viruses, bacteria, or any other foreign particles that may enter our body. The immunoglobulins have 5 different subclasses. These include IgA, IgD, IgE, IgG, and IgM. Today, we will mainly be focusing on IgEs as those are specific to allergies. However, we will briefly touch on IgG at the end. Like I said, IgE, those are specific to allergies. Each type of IgE is specific to one type of allergen. So another way of saying that is if someone has an allergy to something, like cat or dog, dandruff, they would have multiple IgEs for that allergen. So allergies. Allergies are the immune system, is the immune system overreacting to certain particles. When these particles enter your body basically thinks, oh, these are dangerous or harmful, and it sets off a bunch of alarms. These alarms produce cells that carry those IgEs, which travel to the invader, and these cells release the IgEs in effort to protect the body and destroy the particle that is causing these alarms to go off. That release of all the IgEs at once is what's producing what we see or know as the allergic reaction. So that can range anything from sneezing, eye watering or itchiness, any kind of skin itchiness, nasal congestion, all the way to more severe symptoms like wheezing, shortness of breath, or even shock. There are actually 4 different types of allergies: anaphylactic, cytotoxic, immunocomplex, and cell-mediated. We will just be focusing on anaphylactic today, mainly because that's where the allergies, or that's where the food allergies play into, and that's the most common one that we all know of. With these 4 different types of allergies, the symptoms and severity of the symptoms can differ among all 4 types. So anaphylactic allergies. Again, this is the most common type. The food allergies, skin allergies, allergic rhinitis, so anything inhaled allergen like cat or dog dander or pollen, as well as asthma, all fit into this category of anaphylactic allergies. Again, symptoms can range from anywhere from mild to life-threatening. So again, that could be anything from a running nose or sneezing all the way to these most severe reactions that you see here. These most severe reactions are known as anaphylactic shock, which many people associate with people having a sting from a bee or maybe like a peanut or peanut butter allergy. These can come from, again, foods, they can come from medications, even latex, and insect stings. What really happens in this is that your body has, in order to combat the foreign substance, your body drops in blood pressure, and because of that, that can lead to difficulty breathing and overall shock for the body. For these types of severe reactions, they need to be treated with epinephrine injections, or what we may know as the EpiPen. One thing to note about this, however, is that anytime that you do administer an EpiPen to anyone, know that you need to call 911 and treat this as a medical emergency. The EpiPen only releases enough epinephrine to, I guess, reshock the body to be able to function for a certain amount of time before they're needing more of that epinephrine, which can only be administered medically by a medical professional. So again, anytime that you do administer an EpiPen, make sure you're calling 911 at the same time. So food allergies, what we're all here to talk about today. So with food allergies, there are nine most common foods that people are allergic to, and these are what's known as the big nine. And these include, as you can see, milk, eggs, fish, shellfish, peanuts, tree nuts, wheat, and soy. Um, these these types of foods can have again can have it can produce any kind of mild reaction to severe reactions. The most severe ones can include any kind of swelling of the mouth, lips, face, or throat. It can also include vomiting and loss of consciousness. The more mild, again, can be anything from nasal congestion or hives or any kind of itching. With this also, some people may experience symptoms immediately, or people can experience symptoms up to 2 hours after consumption of the food. Diagnosing and treating these allergies. Again, these are specific for food allergies. So allergy tests. These have to be performed by a doctor, specifically an immunologist or an allergist. This is done by measuring the amount of IgEs in the body for that particular type of allergen. And this can be done via a skin or blood test. Again, depending on the type of potential allergen. With food allergies, you can mainly do that through a skin test. These skin tests are the gold standard, quote unquote, the gold standard. You can do this with the prick test. So that's done by placing a tiny drop of the potential allergen on top of the skin and waiting to see if it produces any kind of skin reaction. So maybe like a hives or maybe a small rash or something like that. This can also be done in what's called a intradermal test. So it's kind of the same idea. They take a small drop of the potential allergen and they just place it a couple layers under your skin to see if it produces any type of reaction. Treatments with allergies, obviously the first one in doing this is to avoid the potential allergen, or to avoid the allergen, I'm sorry. You could take antihistamines, especially if it's any kind of seasonal allergy, including Benadryl, Zyrtec, Claritin, Zyzol, different over-the-counter medications like that. In some cases, you can do allergy shots if that's something that you would like to try to become, I guess, less allergic to. However, this cannot be done for food allergies. Again, for the severe emergency cases, EpiPen or any containing the epinephrine can temporarily treat that allergy or allergic reaction. Again, what to do in emergency, I just want to cover this again. So especially with the food allergies, you want to stop eating that food immediately. And then yourself or whoever is around you evaluate the symptom and the severity of the symptoms. If it's mild, you call a doctor for evaluation. And this is important because the symptoms may not always be resulting of an allergy. It could be from another underlying issue. So you definitely want to make sure you see your doctor if you're experiencing any kind of mild food allergy. If it's severe, again, administer the EpiPen and call 911. Okay, so now that we know what a food allergy is, let's shift to food intolerances. So, a food intolerance affects the digestive system. So, your digestive system technically includes starting from your mouth all the way down to your rectum. Um, in the food intolerances, your body does not produce enough enzymes to properly break down that particular food during digestion. So enzymes are these cells that whenever we do eat food, they come and they kind of break it more down for us. If you don't have those enzymes to break down that food, then that's what's causing some of the symptoms that we'll talk about. Um, Another way of saying this is that your body is sensitive to naturally occurring chemicals in foods or food additives. This is also known as a food sensitivity. These are not life threatening in any way. In general, someone can eat a small amount of the said food that they're intolerant to without experiencing too much discomfort. The most common allergies here, these first couple you're probably pretty familiar with, lactose intolerance. This essentially means that your body does not make enough lactase, which is that enzyme that breaks down the sugar, that naturally occurring sugar in dairy products known as lactose. So if your body doesn't produce enough the lactase to break down the lactose, then that lactose will cause some of those symptoms or some discomfort. Gluten intolerance, this is an intolerance to the gluten, which is the part in the carbohydrates that is in wheat, barley, and rye foods. Um, the difference between this and what a gluten allergy looks like is that the allergy, also known as celiac disease, is that allergy actually damages the small intestine. So somebody with celiac disease, if they eat something that has a gluten in it, that's actually damaging their small intestine, whereas someone with an intolerance may experience some discomfort, not some great symptoms. However, there's no physical damage being done to the body. This last one, a dietary histamine intolerance. This one's probably a little less known. Um, but essentially, histamine is a naturally occurring chemical in some foods. Histamines are needed for the production or the building of amino acids, which amino acids are essentially the building blocks for proteins, both in our food and the protein inside our bodies. Um, so the histamine intolerance, this is thought to be due to the lack of what's called diamine oxidase. Again, kind of the same way that in lactose intolerance, that enzyme lactase, if you're lacking that, then it won't break down that lactose sugar well enough. In the same way for the histamine, if your body doesn't produce enough diamine oxidase, then you're not going to break down that histamine very well, which will result in some symptoms. Um, Histamines are present in many foods, including different kinds of cheeses, especially feta and blue, grapes, bananas, and then because of grapes, they're in wine and champagne, pineapples, and most pickled foods like tomatoes or sauerkraut, also including some cured meats. Some foods do contain higher amounts of histamine, and some foods contain less. Same with the lactase or lactose actually. Um, some cheeses actually and dairy products contain more lactose and some contain less. So common food intolerance symptoms. This can include anything from constipation, diarrhea, gas and bloating to nausea, vomiting, sometimes vomiting, upset stomach in general, heartburn, or even headaches or migraines. So with diagnosing and treating food intolerances, there are actually no specific tests done for any of these sensitivities besides lactose intolerance. With lactose intolerance, there is a test that's called the hydrogen breath test. Again, this is for lactose intolerance only. This is you basically drink a beverage that contains lactose in it, and about 30 to 60 minutes later, the doctors will test your breath for hydrogen particles. If your breath contains a certain amount of hydrogen, then that would indicate a higher, I guess, sensitivity to lactose. Um, Again, there's no specific test for other kinds of sensitivities or intolerances, which I will talk about that in the next slide briefly. So for helping with treating or managing any types of intolerances, first and foremost, I would recommend trying to keep a journal to help track your intakes and symptoms. I would recommend tracking exactly what time that you ate the food, what food specifically you ate, and then what types of symptoms you had, how long did the symptom or how what was the time between the symptoms occurred from when you ate the food, um, and any other resulting symptoms or anything else you would like to add. Something else you can try is eliminating that specific culprit for a couple weeks or so, and slowly building that food back into your diet. If you're still experiencing those same symptoms, even later on, then you might be more sensitive or tolerant to it than you originally thought. Again, most effective treatment, if you really are intolerant or sensitive to a specific kind of food, is just to avoid it completely. Um, any kind of relief that you can get from, or any kind of relief uh, from those symptoms can include anything from antacids, antidiarrheals, laxatives, or specifically for lactose intolerance, Lactaid. Lactaid is in pill form is that lactase enzyme that you can just swallow essentially and gives your body the enzymes to break down the lactose in the foods more easily. Okay, so like I promised from the slide before, with food, I know there's a more of a trend out there now, or this has become a trend with the food sensitivity tests that it has been pretty recent today, especially on social media. However, I'll give you this information and you can do with it what you will. Um, just from a research perspective, food sensitivity tests are not accurate and they're not actually researched very well. When you are doing these food sensitivity tests, they're actually measuring for the IgG antibodies, which is also known as that memory antibody. So when you do these tests and it's measuring the IgGs, it's essentially just measuring the foods that you've eaten most recently. Um, so the more of one type of food that you had to eat recently, the more IgGs you will have. So if you ate something with a lot of dairy in it, maybe you had a thing of ice cream and you had a grilled cheese sandwich before that or something, that test may come back saying that you have a high level of IgG antibodies, or you may be really sensitive to dairy or lactose foods. But it really is just because you just ate a lot of dairy beforehand. Um, and there's even been research suggesting that high levels of IgG may even suggest higher tolerance of the food. Um, Both the American Academy of Allergy, Asthma, and Immunology and the Canadian Society of Allergy, Asthma, and Immunology have both recommended to not use these food sensitivity tests to diagnose any kind of sensitivities or intolerances. If you are having any concerns or feel like you need to talk about your concerns with someone, I would definitely recommend speaking with your doctor first and foremost, and or a dietitian to address any of the concerns or symptoms that you may be experiencing. Okay, so I just wanted to put a side by side the differences between allergy and intolerance specific to foods. Again, food allergy involves the immune system, while an intolerance involves the digestive system. In a food allergy, your body sees the food as being dangerous, whereas in a food intolerance, basically your body just can't break down the food properly. Food allergies can be fatal. Intolerances are not life threatening. Um, to kind of reiterate that, food allergies may need immediate medical intervention. Food intolerances definitely do not need immediate medical intervention. However, something that they both have in common that they can an allergy or an intolerance can develop at any time. Um, as I want, and I also want to say, especially with people with any kind of GI disorders or diseases, they are definitely more likely to develop an intolerance more so than the average Joe who does not have any kind of GI issues. And again, we kind of just talked about this. Food allergies have very specific testing. Food intolerances do not have specific testing except for the lactose intolerance. These are all my references in case you were wanting to go back and look at any of those. Um, that is the end of my little lunch and learn for you. I hope you learned something new and could even pass on this information to other people. Um, if you have any questions, please email us at that email listed there. You can also find more wellness content on Healthy or on our Vimeo channel. And an additional reminder, if you are on a Wayne insurance, you have access to free one-on-one health coaching with us wellness coaches. If you're interested in that, go ahead and shoot us an email. All right. Well, that is all I have for you today. I hope you have a great rest of your day, and we will catch you next time.